Our next speakers are from ISIS. Amanda is from ISIS, the Eating Issues Centre, and also from the Eating Disorders Association Qld. Welcome.
So, hello, my name's Amanda from ISIS, the Eating Issues Centre, and this is my colleague Cath Doyle from EDA. Our presentation this morning is a little bit of a watch this space. There's lots of change and transition happening. The eating disorder component of the RFO was the only mental health issue that was separated out in terms of funding, and we're still negotiating with Queensland Health in terms of how that's going to roll out. And at the moment we're negotiating around having a separate service type to recognise clinical counselling for the eating disorder sector. So that's something that's still happening. So a lot of the model that we presented is still under negotiation. So one of the things that's really clear, and was very clear also to Queensland Health, is that there's a real need for specialist eating disorder services and partnerships. Eating disorders are the 12th leading cause of Australian mental health hospitalisation costs. The yearly healthcare cost is about $1 billion, and social economic costs about $60 billion, according to a Detroit economic study completed in 2012 by the Butterfly Foundation. Eating disorders have the highest impacts on health-related quality of life of all psychiatric disorders and can develop into chronic disability without early intervention. The mortality rate is the highest of any psychiatric illness, with the highest medical and suicide risks. So there's a lot happening in the eating disorder space, and one of the changes in the funding for NGO sector is the move away from the early intervention and prevention aspect into the shift to the clinical, severe and persistent mental health, and really looking at what that means for eating disorders and the need for, funding for the continued provision of the early intervention, recovery maintenance work, as well as relapse prevention. Eating disorders incidence is also on the rise. It doubled between 1995 and 2000 and is expected to rise to more than 1 million Australians by 2022, and it affects men and women across all ages. Approximately 180,000 Queenslanders, or about 4% of the population, have an eating disorder. 87,500 of those living in the Greater Brisbane area, and of those it's estimated conservatively that about 20,000 are seeking help around eating issues at any one time. That's not just obviously coming through ISIS and EDA, but it affects all of the services in relation to mental health as well as outside of that. So ISIS and EDA submitted a joint tender, ISIS as the lead of that tender, and we're really doing this as part of a wider reform, both in terms of national reform, statewide reform, big shifts in the eating disorder sector. There's changes in the child youth mental health space in terms of the age of the eating disorder clients of that service. There's all sorts of things happening in terms of national eating disorder collaboration. And I guess the aim of our model was really about wanting to establish an innovative, collaborative Brisbane and statewide service delivery model for integrated response by eating disorder specialists, not just in the non-government sector, but also with government and private sectors also. The service delivery model is based on evidence-based practice, sector consultation and consumer and carer feedback, and there needs to be more done to ensure the model that we deliver is on target with where some of the changes are happening. So in terms of the benefits of the eating disorder model, really we're wanting to improve access to intensive community care for clients with complex needs.
We're doing this as a tag team. Stronger linkages and increased capacity of clinical and non-clinical partners.
We'd like to be working better with the services that are happening in the health space, and Elaine from EDOS is at the back, looking at how we do complex coordination for eligible clients and how that's shared between the government and non-government sectors.
More consumer and carer groups and programs to meet demand.
We'd also like to look at increasing greater access to post-discharge intensive clinical counselling.
Economies and efficiencies from collaborative efforts by ISIS and the EDA.
We want to look at how clinical and non-clinical care can be better integrated and provide better support for consumers and carers.
And also to ensure that we have consistent professional intake, early identification, risk management, increased community management.
And I guess the bottom line is that we want really there to be better outcomes for people with eating disorders, both in Brisbane and statewide. We are in a transition process. Both services, ISIS and EDA, have 17 years experience working in this field, and we're in the process of doing further joint planning and collaboration, looking at evaluation and formalising and expanding partnerships, so also looking at who else we need to bring into this space, and really wanting to expand the provision of flexible, integrated and seamless Brisbane and statewide service provision with people with eating disorders, carers and families. Just to give you an idea of referrals in the space at the moment, we've got, obviously, that's the website for ISIS and EDA. There's also the contact details there for the Eating Disorders Outreach Service. There's in this space, it's really important that the hospital and health services work really well with the non-government sector, and really wanting to continue to improve that. We've also got the QT Health Clinic that's running a new eating disorder program. We've got ongoing private hospitals, including New Farm Clinic, that are doing support in the eating disorder sector. We've got some great programs for adult mental health, child youth mental health, Gold Coast programs, Maudsley programs, and a whole lot of things that are happening in that space. There's some great access pathways that Elaine and the eating disorder sector have collaboratively put together, which really is great for people to know what the admission criteria is for both psychiatric and medical admissions. That's available on our website. I'm not sure if it's quite gotten up on the Queensland on the interweb, but I'm sure Elaine from EDOS can help out for people that have that. There's also a fairly new development in the national space. So there's the Eating Disorder Hopeline, and they also have a online chat email counselling presence. There's opportunities for people to really upskill, both in terms of the Eating Disorder Network, professional development opportunities in Brisbane, as well as nationally. So the Eating Disorder Collaboration has a great website for information, and there's also the Australian New Zealand Academy of Eating Disorders. The next Eating Disorder Conference is going to be held at the Gold Coast, so there's some great opportunities for people to upskill in relation to eating disorder service provision. A little bit more about ISIS. We're located at Highgate Hill here in Brisbane. Our vision is for the best possible health and wellbeing for every person, family, community in Queensland through promoting positive body image, a body acceptance and health at any size approach, and working towards prevention, recovery and freedom from eating issues, both for the person with the eating issue and socially, in terms of the kinds of changes we'd like to see in terms of social pressures around body image and appearance. Our mission is support, understanding and change, and alongside that recognising that health, recovery and positive change is possible on both those individual and social levels. This is a little bit of an overview of our previous service types and what we have been providing. So we've been doing social and personal development through group work for the past 17 years, and we'll continue to offer our 10 and 18-week clinical group program. There's individual advocacy, and we've also obviously been doing information support and referral alongside the Eating Disorders Association and EDOS. The community education component is no longer funded, but we are still offering that in a fee-for-service capacity and looking at alternative funding streams for some of that prevention work. And we're hoping to continue the clinical counselling and have that recognised as a specific service type. Our next 10-week group is starting tomorrow night. I think there's one place available if you have referrals. But yeah, just giving you an idea of where we're shifting at the moment at ISIS. People can access intake appointments and free counselling, and we're in the next step of developing the collaborative model around our triage and referral, a set of follow-up for both Brisbane and statewide, and also looking at continuing the mutual self-help and peer support aspects of the ISIS program. Hand over to Cath to present a little bit about what's happening at EDA.
Thank you. The EDA is actually located at Greenslopes. We are a not-for-profit organisation founded in 1996 by people who had been affected by eating disorders and their carers. We are funded by Queensland Health. Previously, to provide recovery-orientated support, information and referrals to people with eating disorders, their friends, families and carers throughout the state of Queensland. So our current service provision at the moment is what our previous service provision was. So as we undergo this transition process, we are still providing these services at the moment. Recovery-orientated support, which is short-term support, and that comes via telephone, appointment, or quite often we get drop-ins, but it is not case management. We don't provide that at present. Support groups and workshops for people living with eating disorders, their families and carers, and peer support networks of volunteers who have recovered and carers who have supported someone to recover, and that's done via telephone. Information and community education. So resources, we have a lot of resources in our office which we send out quite often. We also have a library, a monthly newsletter which goes out to members on topics of interest, and also body image and eating disorder workshops to schools, universities and the broader community. We also have a referral database, so people can contact us throughout Queensland and we can refer them to health professionals in their area who have expressed an interest or specialise in eating disorders. One of the things that this collaboration or this transition toward collaboration has done, I think, for us is actually allowed both ISIS and the EDA an opportunity to really reflect on what our service provision was and work together toward providing or developing a service delivery model that is going to be more integrative and innovative for the people that we are looking after, so for consumers and carers. And having the opportunity to do that in consultation with other organisations within the eating disorder sector, as well as Queensland Health and consumers and carers, has been quite exciting for us, but it also hasn't come without its challenges. So we, as we transition into this new service delivery model, that is challenging. And I think one of the things that Brett alluded to earlier was staffing hours, which both organisations don't have a lot of, so that is certainly a challenge. But we're both really looking forward to, Amanda and I think, are really looking forward to working together and seeing how this pans out. So, as Amanda said, this is a watch this space, and we will be keeping you informed as we start developing these new and innovative services so that you will have some referral pathways. If you need any further information from us, this is our contact details, and we will be around for a little while if you have any questions. Thank you.